Customer, here are the tomatoes. What else shall I give you?
Hot pepper and Auntie, this your cough is getting out of hand now.
Take it easy with her now. But customer, this is your cough. You should go to the hospital.
You know I can't go there with this cough at this time. They'll just say I have COVID-19.
Customer, every cough is different. It could be tuberculosis.
It's true, Auntie. Check am, make you dey sure.
Because who no go?
No go, no.
Check that cough for tuberculosis.
Check am, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
Some women there dancing and singing praises of Rotary Sunday Olaniyo and his team at the Rotary Club of Iyana, Iyesi for their intervention and renovation of their health facility.
I came to visit the health center for their needs assessment so that we can at least support them. I know even the general hospital cannot fulfill 100%, but they have been trying their best. At least about 70% of their services being rendered to them by virtue of my interrogation with them. Even as of today, they're supposed to have their antenatal program today, but it's quite unfortunate for this kind of program. We really designed it to suit the purpose, but it's only 30% at present. Probably it might be as a result of festive period that they couldn't come, but eventually we were able to get the crowd needed and they could get the target audience for the education. The
club members went further with the donation of vital medical tools and baby items.
And that is how Rotary works. We might receive millions of needs, and we might be able to satisfy about 70 or 80% of it. If possible, in some areas, we can fulfill all the needs.
By my virtue of assessment, they couldn't get all these real medical equipment for them to improve the standard of living in the environment. But actually, my first intention was just to keep the environment tidy, and that has actually accounted for the painting and the supply of the medical equipment.
Rotary and Rotarians. So we are here to change people's lives. We have been doing it in the past. Rotary Club emanated right from 1905 by a person called Polaris Fellow. And in 7 areas of focus.
Primary health care is actually the first level of health care that should be able to take care of minor illnesses. But because of underfunding and because most of them are not functional, that is why people bypass them and then go straight to either private hospitals or general hospitals and then other government hospitals. But if there is enough funding and enough personnel, at least having at least one doctor in every primary health center that can come from time to time to see the patients, it will go a long way. And then adequate funding and provision of the necessary equipment that are needed at a primary health center, at a primary level, it will go a long way in reducing maternal mortality in the country.
To empower the community women with knowledge about maternal and child health, as well as other critical health issues, the event also featured health talks.
The main purpose is to educate, most especially the pregnant women within our community, on how they can have precaution before and after their childbirth, and how to reduce the rate of deaths even before they conceive and after delivery.
During pregnancy
and childbirth.
for causes that are avoidable.
Fún àwọn èrèdí tó jẹ́ pé ó ṣe mójútó ó dẹ̀ ṣe mú kúrò ní ọ̀nà.
And that's one of the things that this lecture intends to achieve.
Ìdí rèé tí a fi gbé irú ẹ̀kọ́ yẹn wá síbí lónìí.
I'll be very brief.
Màá ṣe ní ṣókí.
So, what is pregnancy?
Kí là ń pè ní oyún níní?
And how does it start?
Báwo ni ó ṣe bẹ̀rẹ̀?
You know that for pregnancy to occur,
ká mọ̀ pé kí oyún kó tó lè wáyé.
of course, a man and a woman has to
Ó dá wa lójú pé ó nílò àṣepọ̀ ọkùnrin àti obìnrin.
Naturally or artificially.
Bẹ́ẹ̀ ìbáà jẹ́ ní ọ̀nà tòótọ́ tàbí ní ìdàkejì ọ̀nà.
Because there is artificial fertilization.
Wọ́n ní pé ọ̀nà ìdàkejì mìíràn náà wà tá a bá gbé gba ọ̀nà tí Ọlọ́run dá.
So when the sperm and the ovum meet,
Nígbà tí nǹkan ọmọkùnrin àti ti obìnrin bá pàdé,
that is the point that pregnancy
ibi
starts.
tí oyún ti bẹ̀rẹ̀ ní eléyìí.
And from this point,
Láti ibí yìí lọ,
the body of the woman begin to undergo a lot of change.
Promoting good health and well-being of people across the world is one of the focus areas of Rotary Club International. Since the assumption of office as the charter president of Iyesi Rotary Club, Rotary and C.D.A and his supportive team have done a lot in this direction.